This is Nursing 105, Module 6.3, I believe. Primary IV setup. We already have our IV in place with my fake arm there. Just a note, my catheter's not going into the towel. I thought it would last longer and be fresher if I just had it just off the end there, so it's set up properly. Just doesn't have it directly going into the towel. So, but it should suffice for the demonstration we have here. So, so let's get started. So we are going to administer today 500 milligrams of normal saline. Doctor has ordered 125 milliliters an hour, which is going to be, we have a 10 drop set here. So did the math, and that's about 21 drops a minute. If you are doing it on a straight drip rate on a 10 drop set, that's going to be about 1 drop every 3 seconds. So let's go ahead and get started. We just compare our medication here. Make sure you have the right medication. We have normal saline, 0.9% sodium chloride, 500 milliliters. And we're going to administer 125 an hour, so that should last us about 4 hours on this bag. If we did it for a whole day, we'd obviously probably use 1,000 bags, but that's what we got. Expiration September 22nd, I'm sorry, September of 2022. So we're good on that. Even if we weren't, we're pretending it's good. So I'm verifying that. Have to make sure that Mrs. Davis does not have any allergies. Mrs. Davis, do you have any allergies? No, you do not, of course, because we've already checked that. Secondly, we're going to make sure we're going to provide privacy if necessary. We're simply attaching the IV pole or attaching the fluid to the IV existing site, so there's nothing horribly invasive, but we'll close the door and curtains if necessary, if anything, to protect HIPAA for her. So let's go ahead and get started. We got our fluid, we've got our IV set here, we've got alcohol prep pads. We're going to need those to sanitize our site that we're going to attach to there. Got our IV pole / command hook set up there. Let's sanitize our hands. And Mrs. Davis, can you please verbalize your date of birth for me, your first and last name and date of birth? And I am verifying that it is the same on her ID band, 9/1964, and her name is the same, and I am verifying in the MAR on the computer. Most facilities now have it where you barcode the medication you're giving to verify within the MAR. Also, we've got a paper one here, and that verifies that it is Mrs. Davis is the one that's supposed to be getting the medication. So we're going to go ahead and open up our fluid bags here. Now, this is an aseptic technique. It is not a sterile technique, so we don't have to worry too much about maintaining sterility, except a couple things are very important. I'm going to keep that plug on the end of the IV bag to begin with while we open everything else up here. Go ahead and remove this little white band here because it's gets to be a pain in the butt later. Trust me, I know. Untangle it just a little bit here, again, from experience, so we don't have to worry about untangling it later. Usually they come apart pretty easily, but I'm making myself out to be a liar here. Okay, we have all that ready to go. So make sure when you are spiking the bag, make sure that the actual port you're putting into is fairly straight. Again, from experience, these are not super sharp, but they will go through the side of that port. So make sure that you be careful of that. And there's 2 different ports here. You got the blue one, which is for spiking it. The second one is for medication. If you were to inject medication into this 500 bag and then create a bag of medication at that point. So we're going to remove the cap on the spike. Now that spike is sterile, so we can't let it touch anything but the inside of that port. I'm going to go ahead and pull this little plug, pull it off. Now you notice also it's upside down. If I did it the other way, I'd be making a mess at this point. So I'll go ahead and slide her in there. It's okay to grab the outside of this port to kind of stabilize it. So we're all the way in there. We're going to invert it. Go ahead, and at this point there's already fluid flowing in that line. So just to not make a mess, you want to fill this chamber about halfway, and the way you do that is squeeze it a little bit, and we want to make sure that we have all the little tiny bubbles out of the line, because we don't want to inject air into the patient's body. And we have all, sometimes you got to shake the line just a little bit to get all the bubbles out. Looks like we have them all down. The roller here, gonna lock it down here to make sure that we have it locked up. So now at this point, we're gonna go ahead and perform hand hygiene one more time. And we're gonna verify for a third time that we have the right medication, normal saline. We have a 10-drop set here so that we are using the proper drip rate, which again we've determined is 21. I'm gonna go ahead and put these gloves on after my hands are dry. It's hard to put on gloves with wet hands. These are just clean gloves. They're not sterile gloves. This is not a sterile technique. All right. Alcohol prep pad to make sure. We're going to also verify that our site is good. There's no redness. There's no rash. It's patent. You can flush it ahead of time just to make sure. That's not a bad idea, but you're going to be flushing it with your line anyway because it's just normal saline, so shouldn't really have to. But I'm going to go ahead and vigorously wipe the end of this to make sure that we have nice clean site. And go ahead, you can, this should be clean because you haven't removed the cap yet, so the end of this is sterile. Make sure again you do not touch that tip there. You can touch the outside, that's fine. It's a lower lock. You simply press it together, turn it until it stops. All right, and we had our chamber locked off. We're going to go ahead and set our drip rate, and we're going to do 1 every 3 seconds, so you can count 1, 1,000, 2, 1,000, 3, 1,000. It's not necessary for this exercise, but that's just how you do a drip rate there. 1, and we set our drip rate. So actually, now we're setting our drip rate. There we go. We're locked off. That's about right about there. Well, we're going to lock it off so I don't make too much of a mess on my table or the end of my table here. So, okay. Now we are going to go ahead and record the document in the MAR, which we do separately, obviously, in this exercise on the DocuCare website there. But that is setting up a primary IV line. Pretty simple.